Synovial cell sarcoma it's a type of cancer. It's a soft tissue cancer. So they get a mass, a tumor. It usually happens in the extremities, in the hands or feet or legs are really common places. It's about 1 in a million will have this specific type of sarcoma. With my daughter, because she was 11, well actually she was 10 when she got it, they were really surprised that it was this type of cancer because it's not seen in children a lot. It's usually in the 20s to 30s that people will get it, and it happens more in males than females. So it was really rare that she got it. When she started having problems, she had pain in her foot, and I just thought, oh, she's a kid. She's jumping around and she's bruised it, and it's not a big deal. By the time that I realized there was something, even our doctors didn't think that it was cancer. We went and saw a clinic and they x-rayed it, and they said, well, if it still hurts in a week, go see your general practitioner. And it was still hurting, so then we went and saw a general practitioner, and he said, well, I don't know a lot about feet. So then he sent us to a podiatrist, and the podiatrist looked at it and he said, oh, well, I can feel a mass in there, but it's probably just something that needs to be drained off. But I'm going to send you for an MRI just to make sure. Send us for the MRI. They didn't think anything of it until they had done the MRI and said, this doesn't look good. Let's do one with contrast now. They did the MRI with contrast, sent it back to the podiatrist, and then he looked at it and said, it looks like cancer, but I don't know what type. I'm not sure. I'm going to send you down to primary children's to the specialist, to more specialists. So we went to the specialist in sarcomas because we knew it was a sarcoma because of the size and that it was a tumor, but we didn't know what kind of sarcoma, and there's lots of different kinds. More common is like osteosarcoma or rhabdosarcoma that are more common in children. When we went and talked to the sarcoma specialist, he didn't even think it was cancer. He said, well, I'm going to biopsy it, but 90% of these aren't cancer, and I don't think it's cancer. So they took her back to do the biopsy, and halfway through they came out, and he said I looked at the biopsy under microscope, and he said it's cancer. I believe it's a synovial cell sarcoma, and I need permission to put a port in her. And so she went in to get a biopsy and came out with a port in her chest so that she could begin chemo. So a port it's kind of a piece that they actually put under your skin, and then it threads up into your heart. And the port, they're able to draw blood out of it and put medications into it, because kids who end up with cancer, they get injected so much. They have to have blood draws continually and medications put in, and chemotherapy is really harsh. And so instead of having to constantly be putting IVs in, they actually make an incision and put this under their skin so that they can just put a needle just through the skin, and it's automatically in the vein so that they can withdraw things and put medications into it. Synovial cell sarcoma. They don't believe that it's genetic. They don't believe that it's environmental factors. They don't know what causes it. We're also in a study for it to see if there's any connections with it, because they don't know a cause for it, and it doesn't seem to run in families or have anything to do with the environment, so they're not sure where it comes from. Like I said, most are in the extremities, and most do happen when they're older, and so chemotherapy doesn't seem to work on this type of cancer, they still give chemotherapy because, like the doctor said, any little cells that have broken off from that original tumor, they want to make sure that they die, that they don't spread, because like any cancer, it can spread to the lungs or into other organs. And so they try to contain it by doing chemotherapy. I know there have been other kids that they just skipped the chemotherapy altogether because they were so young, and they just went straight to amputation because the chemo doesn't seem to shrink the tumor down at all. And in fact, when they biopsied my daughter's tumor after she did end up with an amputation of her foot, and when they biopsied it afterwards, it had only shrunk by 10% and it was 90% alive. And that was after 7 rounds of in-house chemotherapy where she lost her hair and everything, and it was still going. So she did end up with amputation of her foot. When she was having these problems with her foot and the podiatrist said, I think it's cancer, I got on the internet and looked up, what kind of cancer could this be? And I remember thinking, oh, it's probably rhabdosarcoma because it's a soft tissue sarcoma, and it's more common in children. Osteosarcoma it's a soft tissue sarcoma, but it happens in the bones. So I knew it wasn't that. There's other sarcoma types, but they were more adult sarcomas, or ones that were so rare that I really didn't think, because of the location of her tumor and the symptoms that she was having of it, I really thought it was rhabdosarcoma. I had read a little bit about synovial cell sarcoma, and so when the doctor said, I think it's synovial cell sarcoma, I was shocked. I had read such a little amount about it that it was so rare, I didn't think that's what she had at all. It actually probably would have been better if she did have rhabdo or one of these other sarcomas, because those seem to respond better to chemotherapy and radiation, where the type she has doesn't.